When you talk about the pediatric urology in India, the first name which comes to our mind is Professor Shyam Joshi. He's been singularly in India doing the effort to make the pediatric urology as a subspecialty or a separate specialty than urology or a complementary to urology. And to his credit, there are so many patients who have undergone a difficult pediatric operation which have made lots of difference. And today, he has not only pioneered, but he has taught so many of us doing the pediatric surgery rightly. Shyam, you've been trained in England with Alice William.
Yeah. See, the father figure of pediatric urology in England was Professor Sir Dennis Williams.
Oh.
I saw him operate and talk, so I made an every effort to go and work with him for 9 months. And that's when I decided that I will come home and try and establish pediatric urology as a separate branch. Till then, the adult urologists were not interested because they're too busy doing adult urology, establishing adult urology. And the pediatric surgeons, well, they treat children, but they don't know pathophysiology of urology. That's all.
I think the difference between the pediatric surgeon and the urologist, it become more apparent after the endoscopic
Absolutely.
treatment came.
True. Two things. Firstly, the endoscopy. And secondly is the management of renal failure in children.
Yeah.
So when the nephrologist became pediatric nephrologist, or the nephrologist started taking interest in pediatrics, we started getting patients.
Yes.
The pediatric urologist survived a sick child into a treatable child, who then became renal failure, who had picked up early, treated, transplanted, and a useful life.
Shyam, we all are doing a transplant, but transplant in children, especially in an infancy, less than 5 years, is a very difficult. And I know you have done the youngest child.
Yes, I know. The trouble is, it's not the age, it's the weight that matters. So, up till few years ago, 20 kilograms was supposed to be the limit under which you could not operate. But now with the modern pediatric anesthesia, modern technique of doing the transplant, and the management by the pediatric nephrologist post-operatively, not me, them, is what has made the difference. So we have done 110 kilograms onwards, children. Very difficult to do them, but the anesthetists are the ones.
But you do the adult kidney, you put it in
the
abdomen.
Higher up. Because the abdomen is big, but the pelvis is very small. You can't put like what adult, you put it almost in the pelvis, whereas this one has to be higher up in the abdomen. And you have to anastomose the vessel to either the aorta or the common iliac higher up and the inferior vena cava, because the blood flow is that much more important.
I also seen you doing many operations. One of the things you enjoy is the reconstructive surgery, like hypospadias and epispadias, or any reflexes and.
Yeah. See, the reason why a pediatric urologist is better than a pediatric surgeon doing pediatric urology is the fact that you have to combine embryology, pathophysiology, and surgical skill to make the patient be perfect. So you have to assess the patient, decide what surgery to do, and deliver it as per the patient, tailored decision to the patient. And that's where you enjoy. And there's nothing more like, I'll tell you what, an anecdote. I referred a patient after 2 surgeries of hypospadias.
Crippled hypospadias.
So I didn't know what to do. So I told him, you give me 5 days because I have to plan. And I planned and I did the surgery and sent him home. He was doing well. A month later he came and he gave me a small Cadbury chocolate. 8 annas those days. So the mother said, why did he give this? He says, sir, that is from his pocket money. To him, it was almost like giving me a gift. So that's the reward.
I know last year we did an extrophy of the bladder with these people coming to Nadiad. And this year the girl came back. And you see the personality was totally different. She was live and makes lots of difference. I think pediatric surgery needs more recognition in our country. Unlike USA, we do not have a pediatric urology as a separate specialty.
No, we don't.
And we should have it, right?
We should have it.
We should have it.
I know one of the residents of yours came to Bombay to talk to me. And I explained to him that pediatric urology does not bring money. You do one transplant, you do one TUR, you will make more money than what you can do in a hypospadias surgery. But you struggle harder and longer in that result. But if you are attached to an institution like yours, I said you will enjoy the benefit of or get the inner adrenaline going treating these children.
Worth getting a Cadbury from a child.
Worth. Of course. Thank you.
Thank you so much.
To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page and subscribe to our YouTube channel. Happy Docplexing!